Hello, I am Dr. Mike Papola, and we're going to be talking today about injections of botulinum toxin for cervical dystonia. The most commonly involved muscles in cervical dystonia are the splenius capitis, the trapezius, the levator scapula on one side, and the sternocleidomastoid on the other side. However, depending on the position of the head, there are different muscles that can be involved. And this is a good reference to have handy in case you get a patient with a particular head position. The patient we're going to inject today has a cervical dystonia with a fine tremor, and she generously allows us to use her case for this teaching video. We can notice the fine tremor and also a slight tilt of the head to the left. Since I know this patient well, I'm going to inject the splenius capitis, the trapezius, the sternocleidomastoid, and the semispinalis cervicis, which is below the splenius capitis. I generally use the probe in an horizontal position. I move it medially and laterally to inject various points within each target muscle, as shown in this diagram here. Once you identify the targets, you use the standard ultrasound technique to introduce the needle in plane towards each muscle layer, and then you inject the Botox on each muscle at several points. I'm just showing one point of injection. And for the next muscle, we move the probe to the lateral neck and identify the sternocleidoid muscle. This is the sternocleidomastoid, and immediately below the medium scalene muscle. And if we move anteriorly, we will see the brachial plexus, and further anteriorly the anterior scalene muscle. And once you identify your targets, you inject your Botox on the sternocleidomastoid muscle.